All right. I believe we can start the session. So, a very good afternoon, everyone, and welcome to this roundtable consultation on climate crisis and public health, organized by Sphere India's Health Sector Committee and the Academy platform. So, as you all are aware, climate change poses a significant threat to human health, with recent scientific developments highlighting the escalating toll of climate related health risk. So it can be waterborne diseases to food security, insecurity, vector-borne illness, and mental health impacts. The impacts of climate change on health are far-reaching. So our session today aims to deepen our understanding of the interconnection between climate change and health impacts through insights shared by diverse experts in this field and try to understand actionable pathways forward. So today we have gathered esteemed experts who are working in the health sector in India, and we have invited them to share their insights and perspectives on this. So once again, I would like to thank you all for joining today's session as we enter into this very critical discussion. And with that very brief background, I would like to once again welcome you all and hand it over to our moderator for the session today. So I would like to welcome Ms. Michelle Mohan. So Ms. Michelle is a climate researcher and analyst with a strong focus on climate adaptation, private sector climate action, disaster governance, risk reduction, and resilience. She's currently working on capacity strengthening and knowledge sharing for disaster and climate resilience of humanitarian sector across actors with Sphere India. Michelle, I'm giving it over to you.
Thank you, Hannah, for the warm introduction and for also coordinating for this session. Welcome once again, everyone, and thank you for joining us. I am Michelle from Sphere India, and it's an honor to host this consultation with such an accomplished panel that has been working on various aspects related on the intersections of health and climate change. And without any further ado, let me introduce our speakers for today's session. We have with us Ms. Nita George, researcher, Healthy Energy Initiative. We have Ms. Punita Kumar, Program Coordinator, Climate Change and Health, State Health Resource Center, Raipur. Dr. Vaishali Venu, Director, Health and Nutrition Doctors for You. Dr. Praveen Kobragade, Senior Health Specialist at UNICEF. Ms. Atisha Sood, Consultant, Center for Disaster and Health, National Institute of Disaster Management. Ms. Apurva Rastogi, Architect of Cooperation, International Planned Parenthood Federation, South Asia Regional Office. And Dr. V.R. Raman, Executive Director, Center for Budget and Governance Accountability. And as Hannah mentioned, we all know that human-induced climate change is causing serious impacts on human health due to more intense and frequent extreme events, and the number of climate-related event deaths is also rising exponentially everywhere. And it has detrimental effects on food systems, air, water pollution, and also indirect impacts through disaster-induced migration, degradation of natural resources, reducing crop productivity, resource scarcity, shortage of clean water, droughts, floods, and also increase in infectious diseases, malnutrition, mental disorders, conflict over resources, increased violence, including gender-based violence. So mitigating the impacts of climate change can have direct and immediate health benefits. And recognizing this importance, the recently concluded COP28 also witnessed the first ever Health Day and Climate Health Ministerial, which led to the COP28 Health Declaration, which was backed by 120 countries. And as an initial discussion, and by no means exhaustive, today's session delves into the diverse and interconnected aspects of climate change and health. And without any further delay, I would like to invite our first speaker, Nita George. Nita, you have worked on assessing the vulnerability and resilience of health systems in India, and how do hazards like rising temperatures and changing precipitation patterns challenge health infrastructure, especially in low resource settings like India, and how can health infrastructure become more resilient to such extreme weather events? If you can speak towards that.
Sure, Michelle. That will be a great opportunity to be part of this roundtable consultation. I have a short presentation. Is it okay that I share it? Okay. Hi, everyone. I'm Nita George. So I would like to start by saying climate crisis is a health crisis. We all are experiencing the impacts of climate change at some or other extent. Like extreme frequency of extreme weather events have increased, as Michelle rightly pointed out. So this results in injury and death. So health systems should be the center of the community, and they are supposed to provide all the medical services to a vulnerable community at these cases of extreme weather event. And what happened if the health service is also itself affected? So that is a big question. When the health service in a community is affected, it makes the community even more vulnerable. So it is very important that the health system in a particular community is resilient, so that the community is also resilient. So how can we achieve the health system to be resilient? So I think the primary thing which we have to concentrate is that we need to start a climate vulnerability assessment. Why? It is because the impacts of climate change vary over time and space. So each geography, the impacts of climate change differ. So it is very important that we understand what are the climate impacts the particular health facility is facing, so that we are able to define what are the necessary adaptive measures we can take to overcome these challenges. So as HEI India, in collaborating with Idiki District Disaster District Health Department, we have conducted a climate vulnerability assessment. I would like to take you through that to get an understanding on what climate vulnerability assessment and how it is affecting a low-income country and how we can overcome this. So to give a background on where we have conducted our assessment, we have conducted our assessment in the state of Kerala. The state has severely impacted by flood in 2018. So it is estimated by the government that nearly 120 crores of damages was accounted alone for the government hospital itself. And some of the districts were severely affected, where the hospital itself have to evacuate the patient, they have to suspend the surgeries and the critical care. So we conducted a climate vulnerability assessment in Idiki district of Kerala. So it is one of the 14 districts of Kerala. And to say geographically, it has dense forests, mountains, and hills. So in our Kerala, 66% of the power we depend on Idiki hydroelectric power project. And there are 18 reservoirs in this district, and they have 2 major rivers also. And there are 7 small rivers also. So according to the district disaster management plan of 2015, the Idiki district is prone for earthquake from Jan to December. And it is where the summer season start in Kerala from March to May. So the chances of drought and wildfires are more. And June and July, of course, we have rainy season. So chances of flood, cyclone, and landslides are very high. And both in summer season and in the rainy season, our epidemic chances are also more. And as you know, Idiki is a very tourist place. So there are chances of road and water-related accidents throughout the year. So keeping this context, we conducted a vulnerability assessment in 4 hospitals. One, we selected a primary health center in Chakkupalam, and other was a family health center in Kumali, and the third one was a community health center in Mandiperiyar, and fourth was a Taluk hospital in Pyramid. So we were mainly looking at the infrastructure vulnerability of the facility. So we tried to identify what are the past experiences the facility is having with the extreme weather events, and what are the history of the damages, what impacts the hospital has gone through when they face this extreme weather event, and what are the current preparedness measures they have taken to tackle these impacts. So first hospital, we have done our assessment in a family health center, Kumali. So the main problem this facility was facing was drought and landslide. So water scarcity was a major impact of the drought the hospital was facing. So along with that water scarcity, the hospital was also facing the issues of power outage during extreme weather events, like even in heavy rains. Even though they have a backup diesel generator, but there was no backup fuel when it's come to rainy season, because the roads get flooded. They couldn't travel far to get these fuels. And accessibility was also a main issue. And this hospital was located in a hilly area. So it is very adjacent to the forest. So what happened is when it comes to heavy rain, there are chances of mudslides happen in every year. So in the hospital building, which is located proximal to these forest land, they get damaged or they get affected every year. And the second hospital we done our assessment was in Chakkupalam. So this hospital, the cases was different. Heavy wind was a major problem faced by this hospital. The infrastructure damages was mainly due to the heavy wind. And as similar to the previous hospital, accessibility of the staff and patient was an issue. And this hospital doesn't have a backup generator. So power crisis was another major issue faced. And the third hospital we conducted our assessment is Community Health Center Vandiperiyar. And this was the most severely impacted hospital out of 4 hospitals which we conducted our assessment. In 2018, this hospital ground floor was completely submerged underwater. You can see in the picture a road in front of the hospital, and there is a hill behind the hospital. And between that, there is a small bridge. So during rainy seasons, what happened is there are landslides that happen inside the forest area. So what happened during this landslide is there is increased water and mud in the Periyar River of Idukki. So when the water in the Periyar River increases, there are backflow of water to this canal which is running in front of the hospital. So because of that, the water in this canal overflow and it results in flooding of the hospital. I think it's very important to understand, even though there are natural causes of flood, but sometimes man-made action can also result in flood. So in this hospital, this overflow of canal was one reason. The other thing was when the canal get overflowed, the water enters both to the hospital premises and to the road. And this road is a national highway which is commonly used by Sabarimala pilgrimages. So what the Panchayat has done is they had increased the height of this road into 3 feet. So when the water increases, when the height of the road was increases, so when the canal overflows, the water was completely going to the hospital side. And behind the picture, you can see behind the hospital, there is a hill. That is a tea plantation. Idukki is a very famous area for tea plantations. So in this hilly area, when they get water in the hill, they are supposed to come down and reach this canal and reach the river. So all this water together, they accumulated in the hospital, and this hospital was severely impacted in the flood. So in 2018, in the morning 5:30 a.m., the water rushed in the hospital. There was no prior alert. The ground floor was partially submerged under the hospital, and the impact was very high. It was affected their buildings, their medical records, their equipments, their medicines, and everything was totally washed off. And you can see in this picture in the left-hand corner, it is marked as FL, that is the flood level. This was marked by the hospital authorities or the staff who's working in the hospital. So 2018, they have marked like what is the flood level in the wall, what is the level of water in the wall. And 2020 and 2019 also they have marked this in the wall. So this hospital was recurrently facing the issue of flooding. And you can see in the picture that infrastructure are also getting damaged. The one above picture was like recent flood they have faced. And this hospital authorities, they try to take immediate measures, like they try to do whatever that's possible from there, and they keep all the equipments, all the fridges and above the tables and chairs. And right side you can see it's a well. This was like totally submerged into the 2018 flood. So they reconstructed the well. They raised the height of the well so that next time when the water comes, it doesn't enter in the well, and it doesn't affect the sanitation of the hospital. And the fourth hospital which we conducted our assessment was a Taluk hospital in the pyramid. This was a referral center for most of the PHCs and CHCs in the district. So this hospital, even though flood was one of the major issues faced by this hospital, it was not directly affected by flood. The main issue was the power outages during the flood. Even though this hospital has a backup diesel generator, it's a Taluk hospital, so it is a more bed occupancy. The electricity requirement of the hospital is more than what they have. So power outage was a main issue faced by this hospital, along with accessibility of the staff and the network issue. So we try to understand what preparedness measures these hospitals they have taken after these extreme weather events. So we understand there are small initiatives taken by the medical staff, but it came into our notice that this hospital doesn't have a disaster management plan or a standard operating procedure when it comes to an extreme weather event. All the disaster response they have taken so far, that is from their past experience or from the guidance of the senior staff. So what happened when the staff is on leave or the staff moved to other hospital? There is no record or there's no institutional memory of this response activities they have taken. So these are some of the key findings which we understand from this old hospital. All the 4 hospitals, due to extreme weather event, their services were disrupted. They have infrastructure damage, and there was long power outage. Even for the hospitals which have generator, they were lacking the availability of fuel supply. And persistent water shortage was seen in some hospital, and the lack of standard operating procedure and adequate training for the staff, especially when it comes to disaster preparedness and response. And accessibility of the patient and staff was also another issue we find in the hospital. And uprooting of trees and blockage in the road, making a safety concern for the staff and patients. So we come up with few recommendations at the institutional level and at the state level. And first, we suggested a retrofitting of the hospital. In certain areas, they are unable to shift the hospital to other locations. So retrofitting was an only measure they can take in that area. For example, when we got an example of the community health center Vandipedia, that hospital was accessible for nearly 200 tribal population. So shifting it to a far location make the accessibility of these people very difficult. So retrofitting was one of the recommendation we have suggested. Along with the hospital should have a standard operating procedure when it comes to this disaster response. And the staff should be adequately trained on disaster preparedness and response. And the hospital should have powered with renewable energy. And those hospitals which are facing water shortage should have rainwater harvesting facility. And hospitals should have a contingency plan, and that should be prepared in coordination with the local self-government, district disaster management authority, fire service, district medical authority, youth, and civil society organization. At the state level also, we have recommended to increase this climate vulnerability assessment to all the hospitals. And based on the requirement, retrofitting should be made to these facilities. And all the medical staff in the state should be trained on disaster-specific response training. And disaster management plans should be there in all the hospitals. And in long term, the state should transform the public healthcare facility into renewable energy. And this is a key part of our whole assessment. Once we completed our assessment, in coordination with the district medical authority, we were able to conduct a stakeholder meeting. So it was attended by the local self-government, the panchayat president, the ward members, all the medical officers in all the 4 hospitals, deputy DM also. So once in this stakeholder meeting, we were able to share these findings to all stakeholders who were there in the meeting. And we were very happy that we received very positive response from the local self-government. And for example, in the community health center Vandipedia, remodeling of the connecting bridge was the main issue. So LSG provided their assistance in that, and funds was allocated for this, and retrofitting work has going to be started in the hospital. And second, for the FHC Kumali, water scarcity was their issue. So Panchayat has offered their support in drilling borewell and rainwater harvesting. And all the medical officers were togetherly saying the importance or necessity of having the hospitals to be solved. So the interesting fact here is that when we talk to the LSG and to the medical officers, we find that they were saying we didn't get an opportunity to sit in a table and discuss these issues together. So when we conducted a climate vulnerability assessment, we have a documentation of what are the vulnerabilities these hospitals are facing. So we were able to make them to sit in a table, discuss them, and identify the solution so that these hospitals are resilient when the extreme weather event happen next time. In later on, we were able to release this report with coordination with the district collector, and she also offered her assistance in that. Later, we were able to submit it to the state authorities and to the National Program for Climate Change and Human Health also, so that they are also able to recreate similar exercise in other states and make the health system resilient. So, and right now, I think within the Kerala Health Department, the funds have been allocated for the climate vulnerability of few districts as the pilot version. So I would like to conclude that climate vulnerability assessment is the very first step to build our health system resilient, so that we can make sure we are not only the providers of healthcare, but we are also building a basic foundation of preventive and building resilient and equitable societies. Thank you.
Thank you, Nita, for sharing the findings from the study that highlight the multiple factors that heighten vulnerability of health systems, and also the significance of climate vulnerability assessments to identify strategies to increase resilience of these systems. this is a good time to invite our next speaker, Ms. Punita. Punita, SHRC has worked a lot on community-based health committees. What do you think are effective policy frameworks to mandate government responsiveness and engagement with health committees, and also the replicability of models such as Mahila Arogya Samiti to establish community-based health committees?
Thank you, Michelle, for giving me this opportunity to be on this roundtable. And I'm glad that this has been asked, and this is quite an important question. And it's see, the understanding about policy and all that, I really want to put this thing in a way that, you know, whatever the policies are made, we have a lot of studies going on policy, a lot of courses also on policies and all those things. But we hardly, when it comes to implementation part, that is something we really need to understand. That is something missing over there. So even though if we make policies, but they are not implemented, I don't think so. We are making any changes, and we have observed this sort of a observation in many other areas of development. I'm not being negative, and I'm not discouraging the policy making and process. The other most important thing that I want to talk about policy is that, you know, when we are going through the processes for all the policies, it's very research based, very distant from people, and not very much looking into the communities, the minute things, but something is existing which could address this issue. So what at SHRC, what we are doing is we are involving on climate change with the communities, and we have understood the communities in regard to climate change in two different categories: the urban population which is being impacted and the rural population. So we have taken two different approaches. The addressing the issue of climate change and the impacts which we consider, and the thematic areas of climate change that we consider specifically to our region, that is Chhattisgarh, is air pollution, heat. Then we have extreme climatic events. We have other extreme climatic events related to snake bites also, lightning also. So those are all other categories. So this is how we have developed our understanding, and our approach is very clear that when we are working on this, we are approaching in two different ways. Now we need different sets of work approach for rural and urban, that we are very clear. So there has to be very different policies for, you know, the urban settings and the rural settings. And it is very important when we are approaching, when we are going ahead with this, that that we keep the communities at the heart. So whatever is happening around this big, huge global issue today is things are being done, but the more responsibility, the more burden is put on the communities. Be it, you know, less use of plastic, single use of plastic. That is also, you know, the communities have to do by buying e-vehicles, shifting from fossil fuel vehicles to e-vehicles. In Delhi, if we talk about particularly, you have odd and even, you experience that. And then, you know, the way things are working is all the approaches are putting more burden on the communities. So that am I audible?
Yes, ma'am, please carry on.
Yeah. So what I feel is that, you know, this approach has to be somewhere dealt in the policy level, and of course, communities play a very important role, but there are many sources and contributing to climate change. So there are many stakeholders for that. So the responsibilities also has to be of all the stakeholders. This is one point. Supreme Court has recently given the order that you cannot divorce health and health environment in the developmental thing. So we really need to consider it in every step that we are taking now, that you cannot separate the environmental health from the other indicators of health. So here it is very important that how we are going to take it and how we are going to consider the environmental health. The other third important point, what I would like to say is that not to have a vertical approach for this. Even if you want to have a policy, it has to be in such a way which is very integrated, very horizontal. Can't treat it just for one thing. If you are saying it's just because of health, no, you can't just make a policy particularly your health and then go ahead with that. No, it has to be a very horizontal. In health system itself, it has to be in a very horizontal way. Plus, it has to be a very well coordinated policy which involves other departments, other stakeholders who have control over it and who contributes to it. So this is how I look at it. And please let me know if I've missed anything in the question.
Thanks, Punita, for highlighting that communities have to be central for successful policy integration, and also to adopt integrated, horizontal, and multi-pronged approach for successful policies, including different strategies for urban and rural population, and finding a balance between individual burden as response to climate change and collective actions. If you can speak a bit about the replicability of models such as Mahila Arogya Samiti and their successful, the factors that led to their successful implementation, and then we can conclude and move on to our next speaker.
Yeah, I'm sorry to miss out that. Now, women have always been very powerful catalyst in bringing out any change, and they are the worst impacted population also in terms of climate change, be it in the rural or in the urban areas. They are highly impacted. That's what our experience working in the community shows. That's what all the studies also indicates. So the idea was to start working with the women, because they interact with the old age people at home, they interact with the children, and they have a different approach towards dealing with this global issue. And how do they perceive? So we got a lot of insights from how do they perceive climate change. And to your surprise, I must tell that they linked climate change not only from the perspective of health, but they were able to bring it entirely how climate change is impacting the budget of their kitchens, how inflammation, how it is contributing to inflammation, how it is contributing to their the cultural shift of their food habits, how it is shifting to the disease pattern that they are experiencing. So it henceforth became very important that we should work with this important gender which has a wonderful insight and about this concept. And therefore we started working not only with the Mahila Arogya Samitis, but also with the Mitanins, which we call which are called as Ashas in other states, and discussing about what is climate change, discussing about what is contributing, what are the factors. And then they understand and they come up with their own solutions. So small social actions has been taken by Mahila Arogya Samitis in Chhattisgarh. Like if they are near the industrial area, they have asked the industries people to increase the size of their chimneys. One of the most important decisions through these females from Mitanins and Mahila Arogya Samitis was like air pollution. And when they came to know that agarbatti, the incense, has a very high levels of PM 2.5, instead of using the entire packet to show their faith to God, with due respect, they chose on their own. This was a very important behavioral change that they had, that they choose only one stick of incense to do their worship, to do their puja, instead of taking the entire packet. So the shift, in the rural areas, women are understanding, and a huge number of women are, by their choice, they're choosing to go for smokeless chulas, because we just want to, we cannot force anybody to have the choice of fuel. That is completely theirs, but we can surely try to facilitate, to reduce the direct impact. So by choice, what they are choosing to go for smokeless chula, which impacts their personal health, fills the smoke inside the home. So this is how, and now you see, if you go on YouTube also, they are posting videos on how to make smokeless chulas, and some of the videos are specifically from Chhattisgarh. So this kind of shift that has happened in their own behavior, and the kind of their own action that they are showing to others, I think that's very, very remarkable and very, very important. And the important thing is that how well they understand and how well they relate it to the culture shift that we are having. They talk in a different language, but they are very scientific in their findings. So that's it, Michelle. Thank you.
Thanks, Punita, for once again emphasizing stakeholder engagement from the conceptualization to the implementation stage, and how that results in successful policy implementation. We have with us Dr. Vaishali Venu, Director, Health and Nutrition from Doctors for You. Dr. Vaishali, how do you see integrating nutrition, health, and climate change for climate resilience? And like, what are the advocacy recommendations you would give for the same in view of increasing extreme events and changes to basic humanitarian emergency response kits?
Yeah, I was trying to unmute. Yeah, good afternoon, everybody. This is Dr. Vaishali, and I head the health vertical for Doctors for You. Thank you, Michelle, for that question. I would just like to give you a brief, on what all activities we are doing, which is a few of the solutions that we have derived during our activities on ground. So, first of all, with respect to integrating nutrition, health, and climate change resilience, first of all, when we're working in specifically the area of malnutrition, we've realized that in urban as well as in rural malnutrition, the major concerns that the mothers or the families are having is that they are being educated within their communities, saying that a certain particular type of food is more nutritious than the other. So they kind of go overboard and try to procure the food which are not locally available, and try to kind of go like for example, if it is vegetable, they will want to go to buy a vegetable which is not locally procured, but they've read somewhere within their or are made aware with their within the community that certain particular vegetable is good. So instead of doing that, we must do diversification of diets, because something which is locally grown will be far more resilient to the climate change in that particular area, and this will help in reducing the travel transport related to the food. Apart from that, also like sustainable agricultural practices, like in after the farming is done, what happens is that the crops which are cut off and whatever residue is left behind, there are multiple practices that happen in the country where the crop is burnt off, which causes a lot of pollution, especially when the area in Punjab, and the burning of the crops is happening, burning of the crop residue happens in these areas. There is a lot of pollution which happens in Delhi area, the central part of India, because of which we have taken up projects where we try to create awareness among all the farmers in Punjab, Haryana, where they are taught how to use the new machinery, where they can use these crop residues as a part to prepare compost instead of just burning them off. Apart from that, with respect to food, because of the because of the new developments, we've noticed that the junk food is in a very high use amongst, not only amongst the urban but also in the rural areas these days. So promotion of food which is naturally grown in that area and without much processing is better. So that kind of education needs to be given so that there is a security and equality with respect to food. Apart from that, with respect to like children under 2 years of age, we always promote breastfeeding, because first of all, it's very good for the, not only for the child but also for the mother, to create a bonding, to create a good healthy to form a good healthy child. Breastfeeding is very important. So we take care to kind of advocate this throughout all our maternal and child health programs. And also, when a formula fed child is there, there are a lot of waste that gets produced in the overall process, where there is a lot of cartons, a lot of things which are can be avoided when breastfeeding is done. Apart from this, we have a few other programs like wash awareness is one thing. So especially during COVID, we all know there was a lot of increased uptake of hygiene related products, like not only the soaps but hand washes, sanitizers, etc., because of which there's a lot of packaging material which is not very environment friendly. So we have a program called Soap for Hope, wherein we can use the soaps which are there in the hotels are thrown directly, which instead of just throwing these soaps, they can be recycled and can be distributed in the community, where they can use it for daily hygiene purposes. Okay, apart from this, the last is that with respect to we have a disaster secretariat which is specifically working towards addressing disasters and emergency response. So right now we are working in very close coordination with the government, and where tackling of any heat waves related to initiatives and promotional guidelines which are then provided by the government. So those kind of work is being done. So yeah, these are the few of the things. And of course, in education and awareness, so creating an awareness not only amongst the youth, but also the adults. We've been taking this up very much. So that is how we are helping. So yeah, that is how these, I wanted to address this. Apart from that, if there are any questions, I'm ready to take.
Thank you, Vaishali, for highlighting diet diversification and promotion of climate resilient crop management practices along with resilient water systems that are important for ensuring health in climate change resilience. And we also know that children are one of the most vulnerable groups susceptible to health impacts from climate impacts. And towards this, I would like to invite our next speaker, Dr. Praveen from UNICEF. Dr. Praveen, how do you view their vulnerability and what effective approaches can be taken to integrate climate resilience into child health policies and programs, including those implemented within school settings?
Firstly, let me thank Sphere India for inviting me uh, uh, for this talk on climate change and especially the effect on children. I hope that you can hear me. Please, if you can confirm.
Yes.
Okay,
You're
fine.
audible.
Thank you. Right. So, colleagues, as you know that last month, that's the March month, was perhaps the hottest month ever recorded in the history since the recording had started for uh, for the atmospheric temperatures. In fact, it was the warmest March 224 on record, and before that, the 10 months before that were also reported as as the warm and warmest and warmer months. So it has already set a new record, and this has been revealed by the European Union's Climate Change Monitoring Service. So, uh, uh, based on this background, and also another background that the world has made a tremendous progress in reducing the under 5 mortality rate since last 2 decades, and this is from the recently released UN report. Now it is the under 5 mortality rate is at the historical low of around 4.9 million deaths in 2022. So there was a significant decline in this in the under 5 mortality rate. So first is that we are having increased temperatures which are at the historic level, and also we are at another historic level where there is a decline in the number of child deaths. However, now the climate change is posing a threat of reversing this trend, which has been achieved in the child mortality arena. And the climate risks are universal, but it is more concentrated in countries which are poorer, and in communities which are marginalized, especially those which are staying in middle and low income countries. And among them, especially those, and within those communities, especially those in specific groups like the pregnant women, children, elderly people, those who are sick, and those who work outside. So this is all well known. And it is also, there's another statistics which has been said, is currently about 1/4 of children are being exposed to a high heat wave frequency. That means in a year they are exposed to more than 5 episodes of increased heat. But it is also said that by 2050, almost every child will be exposed to more than 5 such extreme high heat episodes by 2050 globally. So why are children, or I'll say pregnant women, more vulnerable? As such, you perhaps will be knowing that during the pregnancy, because of the high demand of the fetus, there's an increased metabolism which happens in the body of the pregnant women, and due to which there's a little bit of high core body temperature which happens, and which leads to increased sweating, and then which contributes to dehydration. And this dehydration can then have increased high risk of early contractions of the uterus, which can trigger early labor. And also because of the vasodilatation and constriction, there will be high blood pressure, increased risk to preeclampsia, eclampsia, and also to diabetes, maternal stress, etc., etc. So, and the birth which can happen can be preterm birth. It can also lead to low birth weight babies, and they can be congenital defects, neurological dysfunctions, etc., etc. So, there the children are more vulnerable. So, the children, even before they are born, even before they come to the world, they are at high risk being in the womb of their mothers. And once they are born, they will be they already come into a world which is facing this extreme climate changes. So apart from that, they're physically more vulnerable because their body has not been adjusted to that of the adults. So they're physiologically more vulnerable for various heat related events like heat exhaustion, heat cramps, heat edema, and in extreme cases even heat stroke. So I'm just talking right now of heat, but then there are other climate related changes as well. When when particular countries are facing extreme heat, they are also facing at the same time extreme winters. And that's the period when children are more vulnerable to the effects of air pollution, to acute respiratory infections, pneumonia, asthma. I've recently just been I recently completed 2 years of an assignment in Afghanistan. And here, sitting in India, we have this unique picture of Afghanistan being a desert, being a hot country. But the 6 months of Afghanistan, that's half of the year of Afghanistan, and around 75% of their geography is covered with ice and snow. And these people live in the mountainous area, and they have less access to, in fact, almost negligible access to electricity and to modern ways of combating those winters. And then they start burning whatever is available with them. For example, paper, they burn tires, and which then releases such kind of poisonous gas, which is a cocktail for doing harm not only to the adults but also to the children, in fact to the entire household. And that's the time when the acute respiratory infections and pneumonia cases, they skyrocket. So it's not only the heat but also the winter, the extreme winters, which is also harmful. Now, these locations, which I said of Afghanistan, are also similar in India, in the hilly regions, especially in the north, Ladakh, Jammu Kashmir, Himachal Pradesh, and in the northeastern region of India. So apart from the heat wave plan, which India and states have, there also needs to be a winterization plan, which will then combat, or which will then have this preparedness and response to not only the heat but also to the winters. So for the air pollution, for for acute respiratory infections, for pneumonia, asthma, etc., etc. So I'll come to the approaches which can be adopted, at least for the India context. Is that we need to have, this is my thinking, we need to have two-pronged approach. One is during the summer and one is during the winter. And I'm talking purely from the health systems point of view. I'm not talking of the other systems which are equally which needs to be equally responsive towards towards climate change. I'm talking let it be the industry or let it be the agriculture, etc. I'm talking purely from the health systems point of view. From during the summers, there needs to be India has something known as IDCF, Integrated Diarrhea Control Fortnight, or a program where the ASHAs, they visit each and every household of an under 5 child and then pre-position the ORS with them. So this is for combating dehydration. Now, this is an opportunity where when the ASHAs visit these households, can they also deliver messages on on uh, on this heat wave and its preparedness by the households? And I think it should not be a national it should not be a national program, but then the states need to be given the freedom for them to incorporate this in their IDCF programs. At the same time, the health facilities need to be prepared to as my colleague Dr. Nikita George has pointed out wonderfully for the Idukki district, with Health Energy Initiative has done. The preparedness of the health facilities during summers need to be different, and need to be different. So if there can be a preparedness for the health facilities during the summers, for example, the IV fluids need to be there. The healthcare workers need to be trained on how to manage each type of this heat related event, like heat stroke, heat cramp. Each of this treatment modality is different. I'm coming to the winters. In the winters, if this particular area, including Delhi, in which I am, this northern part of India, Uttar Pradesh, Bihar, they also face extreme winters. If they can, they should be having, they need to have winterization plans. The healthcare workers, just before that, need to be trained on management of acute respiratory infections, pneumonia, asthma, etc., etc. At the same time, these healthcare facilities needs to be provided with heating elements. I have seen, for example, I visited Arunachal Pradesh, Nagaland. The healthcare facilities are actually burning wood to keep the health facilities warm, and which is causing air pollution more. So the health facility itself need to be prepared, and need to be more sensitive enough, climate sensitive enough to weed off this bad practices. So if we can have this two-pronged approach, one is during the summers, and one is during the winters. At the same time, I think Sphere India is in a very good strategic position. If like-minded professionals can be invited, and if there are checklists which can be developed for the heat, for the summer readiness, and also for this winter readiness, and if it can be disseminated, and accordingly the health facilities can assess themselves and the gaps identified, and then there are plans to be developed to fulfill those gaps. I think Sphere India is in a very good strategic position to guide the country on this. Thank you. Over to you, Michelle.
Thanks, Dr. Praveen, for highlighting the detrimental impacts on children, pregnant and lactating women, and among other vulnerable groups, and the importance of having a climate readiness and also response health systems, preparedness and response plans for different kind of climate extremes, including for summers and winters. And we would like to now, and also for highlighting that climate change will detract decades of progress in global health, development, and poverty reduction while increasing existing health inequalities and pushing many people in the middle and low income countries further into poverty. We have with us next Ms. Atisha Sood from the Center for Disaster and Health, National Institute of Disaster Management. Atisha, can you share how public health strategies can be integrated into disaster response planning, given the increasing events of increasing extreme events, and what strategies can be deployed for strengthening health systems and enhancing community health resilience in disaster-prone regions?
Thank you, Michelle. Thank you for inviting me, first of all. And I have a short PPT that I will share with you all. We have been working in this area of public health resilience for extreme weather events and disasters. So I hope you're able to see my PPT.
Yes.
Yes. So I have been given the topic of disaster response and public health. So before we move ahead to anything else, let's just a minute. I think I'm not able to. Okay. Before moving on to anything else, let's first understand what covers and what comes under the purview of disaster response. So, disaster response is the coordinated effort and actions taken to address immediate aftermath of the disaster, including providing emergency assistance, medical care, and restoring essential services. Why is it important to have disaster response in order to protect the public health? It's important because it provides a rapid response, and this can prevent further loss of life, reduce the spread of diseases, and address the immediate medical needs of any victims or those hit by any disaster. There are many different impacts that climate change has on the health sector and ultimately for disaster management. So when we first understand the different impacts of climate change, it becomes very much easier to include those strategies in our public health response and disaster response, and to come at a common point in order to devise certain strategies which can help in strengthening the public health system resilience. So climate change intensifies the risk in disaster risk reduction and also impacts certain health outcomes. It also increases the frequency and intensity of natural disasters, poses risk for trauma, displacement, certain health risks, including injuries, waterborne diseases, and even mental health impacts are common as an after impact of any climate change related disasters or disaster in particular. It also amplifies challenges in disaster management, necessitating adaptive approaches. It increases the instances of communicable diseases, damage to the health facilities, which are at the forefront of any disaster response, damage to water systems, food shortage, population movements, and mental health problems. Why is it important to have to integrate public health into disaster response? It's so that disasters disrupt essential health services, increasing the health risk. Not only are the health systems impacted by disasters, and not only are they responsible for taking care of the health of the victims of disaster, but they are also responsible for providing essential health services in so many different uh, populations, for vulnerable populations, for even children, pregnant women, people with maybe TB patients, and all of those regular patients that come to the health services. So even they are disrupted during any disasters or emergencies, and it increases the health risk overall of a population, public health, right? And public health strategies aim to address immediate and long-term health needs. So integrating planning leads to a more coordinated and effective response. It also protects vulnerable populations, especially children, elderly, chronically ill patients, etc. There are certain examples of public health integration in disaster response, where we can look at various early warning systems for disease outbreak and natural disasters that have been put in place in our country, and even in other countries that can be seen as examples to apply to India. There are certain vaccination campaigns which are run to prevent the spread of infectious diseases uh, post any sort of, for example, for post any flood or water disaster related event. There are certain preventive vaccination campaigns that are run so that there is a reduced chance of waterborne diseases being, as a cascading effect of another disaster that is already there. There is also an example of emergency medical services which are provided for rapid response and treatment. There are some key, components of disaster response planning for integrating it into the public health sector. This comes under the four, different phases of disaster response, which is preparedness, response, recovery, and mitigation. In the preparedness component of disaster management, what we can do is we can conduct risk assessment and planning, assess our hazards, develop response plans, and identify the resources that are available with us. In the response phase, immediate actions are to be taken, and immediately after a disaster, to save lives, provide medical care, and to stabilize the situation. Then comes the recovery phase, wherein the long-term efforts to restore infrastructure, provide ongoing medical care, and support affected communities in rebuilding is provided. Then comes the mitigation, where measures are taken to reduce the risk of future disasters and minimize their impact on the public health. This constitutes covering the different health aspects of the public as well as protecting our health systems so that they're not affected as severely as they were in the previous disaster, for example. Then there are the public health strategies in disaster response specifically also fall under three phases of disaster management, which is pre-disaster, during disaster, and post-disaster. So what we can do in pre-disaster phase is risk assessment, disease surveillance, public education regarding basic health impacts of climate extremes or disaster that area or a vulnerable population is, at risk for. Then during disaster, we can do mass casualty management, mental health support, safe water and sanitation for all those affected by a disaster. And in the post-disaster phase, we can have debris removal, vaccination campaigns, rebuilding health infrastructures that have been destroyed or disrupted due to disasters. What is the importance of strengthening health systems in disaster-prone regions? It enhances the capacity to respond effectively to emergencies and provides essential health services. There are also a reduced number of vulnerability of communities to health crisis during the disasters. There are different stakeholders and they play certain different roles in disaster management and Disaster Management Act, which applies to any disaster situation, right? So we have three major stakeholders during disasters from the public health perspective. So first we have the government entities. This includes the central and state disaster management authorities, which play a very vital role in formulating policies, plans, and guidelines for disaster management. And they also coordinate disaster response and provide necessary resources. Then comes NGOs and civil societies, like Spare India itself. So these organizations complement government efforts by providing humanitarian aid, relief, and support during the disasters. And in pre-event of the disaster, they conduct, capacity building programs, awareness programs like this one. So collaborative efforts between government and the NGOs and civil societies enhances the overall response effectiveness. And finally comes the medical community. The medical community, including healthcare professionals and medical officers, play a crucial role in disaster management. They provide essential medical care, manage healthcare facilities, and also address public health concerns during the disasters. So this is an overall, structure of disaster management and the allied health sectors in India. We have health sector, disaster management, sanitation, and environment. These are, major stakeholders in disaster management in case of any climate change extreme, or, looking at disasters from a public health perspective. So these can be, seen as national, at the national level, going to state, district, and even at the local level. So synergies between all of these stakeholders at different levels is very important to come to us, effective disaster management and public health resilience, for public health resilience. When we talk about public health strategies into response planning, there are many challenges and some solutions that we can think of, the common challenges and solutions. So one of the major challenges that we face is there is limited resources and funding constraints. Then there can be a lack of coordination among different stakeholders, since there are a lot of departments, lot of stakeholders that are involved in disaster management or post, any sort of disaster or extreme event. So there can be a lack of coordination amongst those different stakeholders. Then there can also be a difficulty in reaching to vulnerable populations such as remote or marginalized communities. So what, proposed solutions or remedies that we can fall on to are collaborative partnerships, strengthening coordination among government agencies, NGOs, and international organizations is very important. Then we have to make sure that there is adequate funding and resources, like there is now the National Disaster Relief Fund that we have, and at the state level we have the State Disaster Relief Fund. So it is important to have those sort of, designated funds designated to disaster management. And similarly, we can have such funds in our health sector that are allocated specifically for climate change extremes or disaster events. So these have to be allocated in sufficient numbers to support public health initiatives in disaster preparedness as well as in response. Then we have to ensure effective communication and coordination. This can be implemented by having communication systems and protocols in place to ensure timely information sharing and coordination among all stakeholders. When we talk about mitigation measures for disasters and emergencies, then we have certain policies that are guiding for those mitigation measures. We have the Disaster Management Act of 2005, which is the central act around which any disaster response or disaster management efforts fall around. Then we have NDMA published guidelines for hospital safety. We also have the National Health Adaptation Plan for disaster-related human health issues, which NIDM itself supported the Ministry of Health in developing. Then this NHAP was developed by the Center for Disaster and Health for Ministry of Health and Family Welfare, and it covers various health adaptation measures for disaster-related human health issues specifically. Talking about certain strategies for strengthening health system, we can have four main strategies, which is investing in robust healthcare infrastructure. First, we have to make sure that the health infrastructure is safe, it is robust, and wherever the retrofitting is possible, it can be done. And the new infrastructure that is being developed keeping in mind different vulnerabilities of a specific area, and such. Then we have to focus on training healthcare workers in disaster preparedness and response. We have to ensure adequate stockpiles of essential medical supplies, and this supply and this adequate stockpiling of medical inventory cannot be a central guideline based thing. It has to be specific to a certain region. They know about their public health concerns, they know about their disaster vulnerabilities, so this has to be customized at the local level to that particular area. So it has to be taken care of in the pre-disaster phase, where the disaster or an emergency has not happened yet, so that this sort of a stockpiling of essential medicines or essential medical inventory can be done. Then we have to maintain strong communication networks within the health system, and also with the different stakeholders that are there for the health systems. One of the most important areas of ensuring public health integration into the disaster management is enhancing the community health resilience. If the community health is resilient in itself, it becomes very it becomes much easier to have disaster disaster resilient communities there. So this includes certain different components, which is community education on disaster preparedness and hygiene practices. We have to build community emergency response teams, which can be made to work after a disaster has happened. Then we can promote social cohesion and mental health support networks, and we can also encourage community participation in risk reduction initiatives in the pre and post disaster phases. There are certain success stories in action which we can take a note of and adapt to our country or our region specifically. So there has been a use of mobile health clinics to deliver medical care in remote areas after an earthquake, right? Then there have been examples of community-led sanitation campaigns following a flood to prevent waterborne diseases specifically. Then in pre-disaster training of healthcare workers, enabling a swift and coordinated response was enacted, and this helped in the disaster when a disaster happened, during disaster phase and also after the disaster phase, so that the communication was already set up. They were trained on what need to be done, who to be contacted, and how that communication had to go on about. So they were they had the practice of that. Then we have to build a culture of preparedness for healthier communities. This can be done by disaster preparedness, and which is an ongoing process and not a one-time event. So it has to be done regularly and repeatedly. Then we have to collaborate with between public health officials, communities, and disaster management agencies. By working together, we can build a culture of preparedness that safeguards public health before, during, and after disasters. These are certain documents that we have helped develop the Ministry of Health and Family Welfare, and all of these can be found on the NIDM website. I'm just giving you an overview of what we have. This is specifically on the area of disasters, public health, and climate change. So we have developed a training module on hospital infrastructure resilience to disasters and climate extremes. Then we have a compendium of case studies on health adaptation and resilience to climate change and related disasters. And we have another training module on health adaptation and resilience to climate related risks. We have different thematic papers on heat and cold wave, the temperature-related disasters, water-related disasters, floods and droughts, then air pollution and public health emergencies, and environmental services for health protection in disasters and emergencies. We also have case studies from regional context on climate-related health adaptation and resilience in India. And these are the training modules that we help develop the Ministry of Health and Family Welfare for different classes of health professionals and for healthcare infrastructure resilience. These are some IEC posters that we also developed with Ministry of Health and Family Welfare to help with IEC awareness for major climate change related disasters, etc. So that is all from my side. Thank you so much.
Thank you, Disha, for highlighting how public health strategies have to be integrated across the different phases of disaster management and also coordination and collaboration among all the stakeholders involved. We are running a bit behind schedule, so without any further delay, I would like to invite our next speaker, Apurva. Apurva, so we have talked about how climate extremes can disrupt health services. So how does climate-related factors impact sexual and reproductive health and its services? And also what approaches can be taken to ensure the resilience of SRH infrastructure and programs in the face of climate change?
Yeah, thank you. I would like to start off with a thank you to Sphere India for organizing such an interesting roundtable discussion on this interesting topic. And I was amazed. I was listening through all the speakers one by one, and I was amazed how a climate crisis is impacting and different areas of health in itself. So I'll be building more on, specifically on the women's and the girls' health, and of course, overall the sexual and reproductive health of an individual. We have been, heard something about, that women's health is at the danger and at the high risk, specifically when it comes to crisis. We have also heard from Dr. Praveen, I think that, it has a lot of impact on pregnancy and then neonatal births and all of that. So I'll be, touching very briefly on all of those aspects. But before moving into those discussions, I would like to start off with the, telling everyone about the basic of SRH, which is, a state of complete physical, mental, and social well-being in all the matters which are related to one's reproductive system. And for that, we should understand that a person as an individual should be able to have a satisfying and safe sex life, the capability to produce, reproduce, and to the freedom to decide if, when, and how they want to, have a family or not. And for all of these decision making, one needs to have an access to accurate information, should have an access to affordable and acceptable contraception methods, should be well informed about the SRHR information around STIs and related, diseases, and should also have an access to skilled healthcare providers and services. And before I start actually discussing the linkages between the climate crisis and SRH, I would also like to, bring to everyone's attention that, by talking about sexual and reproductive health, we are not only considering women's, we are also expanding this whole scope to men, because we believe that, the men also play an important role in supporting women's right. And apart from men and women, there are specific groups, there are marginalized groups, vulnerable groups who are very vulnerable, to the issues. And these groups includes adolescents, people of diverse sexual orientations, and then gender identity. The sad part is that SRH, the sexual and reproductive health, often takes a backseat. There are of course many reasons to it. There is a weak political commitment. There are inadequate resources out there, and of course people are not very comfortable in discussing about sexuality openly and comprehensively. So all of these, has actually resulted to an unfinished SRHR agenda, not only nationally, but also globally. And when we talked this in with reference to the climate crisis, the situation further worsens. Why? Because, the crisis weakens the health system, which definitely is going to create a gap in access, availability, and acceptability of quality SRHR information. And then when this is clubbed with fear, stigma, and social norms, which is there in, specifically the South Asian countries, and of course worldwide also, it also can result in, have actually resulted in worsened SRH outcomes. And apart from all of these, there is a one worrisome fact that I would like to bring to this table, is that during the emergency situations, the donors are also, of course, they want to prioritize things. They want to fund to providing food, shelter, and all of those services. But they may not be willing to provide emergency funding for SRHR, or it's usually not very, underfunded area. Now, while talking about the linkages between the climate crisis, climate crisis can affect SRHR in a range of ways. There can be direct impacts, which include the disruption in SRH services, which further, lead to compromised access to contraceptives, maternal child health treatments, then other HIV treatments, abortion services. All of those get hampered. And then there are indirect impacts. Indirect impacts, we have seen that, increased climate crisis has actually resulted in increased incidences of gender-based violence, early marriages, forced marriages, sexual violence, trafficking, all of those. If I specifically talk about the component, like for example, climate change directly and indirectly impacts the maternal health. It makes pregnancy less safe. It worsens neonatal health outcomes. It worsens global inequity in terms of maternal nutrition. We also heard that, global warming is there, and, it is also going to impact a lot of patterns in the vector-borne diseases, which further, of course, impact the health of a women or a pregnant women. Another area which is has been studied a lot is basically that climate change creates circumstances which is conducive to gender-based violence, and it has also resulted in an increased risk of violence against women. The stress, the scarcity, the pressure on the natural resources during these, crises, can increase the risk of gender-based violence. There are girls who actually, in rural areas specifically, they need to travel to the greater distances to just gather basic necessities such as water. And of course, during these kind of situations, they are at higher risk of physical and sexual violence. Another very interesting area which has come out of these studies is the child marriage. There are circumstances during these kind of crises where people and the families actually, face a financial crisis. And at that time, they think that marriage is a way to reduce financial pressures. And so they push their child into forced marriages. In addition to overall disruption of healthcare infrastructure, there is also disruption in education and the social structures, which again then, linked can be linked to a child marriage. This is what we talked about women and girls, adolescents specifically. But then there is another group which is neglected, and that is the group of people with different sexual orientations and gender diversities. The LGBT, groups, they particularly face high risk of losing their safe spaces where they're, during the time of the crisis. There will be lack of support services. Of course, they have anyways been not, accepted in the societies. So there is a difficulty for them to even find out a safe space to live during the time of crisis. And due to prejudice and marginalization associated with these groups, uh, there is also, we have seen that they are usually, excluded from the disaster management policies and plannings. So this is my take on, what kind of impact climate crisis can have on SRH and what are the different, components to it. But in terms of response, there are three main pillars that we can see. One is climate change mitigation, which means that, we can do something to reduce future climate change. We can, work around the sustainable environment friendly practices, reducing carbon footprint. So all of those mechanisms can be implemented, and then that's one thing that we can address. The second pillar is climate change adaptation, and this basically seeks to lower the risk which has been posed by the effects of climate change. And I think that we need to design gender responsive approaches. We need to apply a gender lens while we are doing the planning, so that we can also build in a component, not very big component, but a very small component of SRH and addressing SRH during the times of climate crisis. And the third pillar is climate change resilience, which points towards need for strong and responsive health systems. And for that, again, I would like to emphasize that there needs to be a realization among all of us, that SRHR is an important component to study and to include if we want to support the holistic climate resilience strategies. We also recently, started discussions around PHED approach, which stands for Population Health, Environmental and Development approaches. So basically, it is a kind of a multi, holistic approach wherein we are, there are different sectoral pathways that can support the countries, that can support the communities in tackling the routine challenges like rapid population growth, poor health outcomes, environmental degradation, because all of these are actually impacting women's and girls' health. And last, also, I think that there is a need of integration of SRH specific policies in the national climate change policy planning and implementation, which is the need of the hour. In terms of my organization, which is International Planned Parenthood Federation, I would just like to close this discussion by giving a very small brief on what we do and how we are basically working towards addressing these concerns. IPPF, it's a global healthcare provider, and we are an advocate of SRHR, and we are committed and we are working with communities to basically get them adapted to the effects of climate crisis and to build a human rights and inclusive environment for them, so that they can again respond to the crisis that happens. We have a global presence because we are a global federation, but we have a local reach. So like in each and every country across the globe, we have our member associations who are actually working at the ground. Currently, talking in terms of member associations, we have around 150 member associations across the globe who are actually working with the communities. And we are also specifically, at times when the climate crisis happens, we have our established networks at ground. We have our service delivery points at ground who are actually get activated when we need to provide humanitarian support to them. I will conclude my talk with 5 key considerations that we think that are needed to better link climate change and adaptation and SRHR, because we still believe that, there needs to be a lot of research has to be done around climate change and SRHR linkages. So the first is, of course, is we need to have a strengthened evidence base on understanding what is the linkage and why SRH plays a crucial role. And also so of course we need to strengthen the research agenda, but we also want to bring this to the globe, to the region, that this is an important area which needs to be studied and which needs to be incorporated into the adaptation and resilience strategies that have been designed. The third is a focus on human rights and gender equality, because we believe that human rights and gender equality goes hand in hand. And if we work towards gender equality, we will be able to develop an inclusive environment wherein we can cater to the needs of women's and girls during the times of crisis. We are also we also think that partnerships and creating safer spaces for all the civil society organizations, bringing them in a form of coalition and working with them specifically around these issues, can also help in improving the whole landscape. Last is the mitigation of climate change. That's what I've said, that we should also be we should also ourselves be working on environmentally sustainable policies, so that we can also contribute to the overall mitigation strategy and reduce the climate change impact. I would say that IPPF is actually in one way or another way is working on around all of those 5 steps. So yeah, with this I would like to end my talk, but um, I'm happy to have more questions if any. Thank you so
Thanks.
much.
Thanks, Apurva, for highlighting how SRH gets often neglected during disasters and emergencies, and also the direct and indirect impacts of climate crisis on SRH, and the importance of gender-responsive approaches and integration of SRH into national plans on climate change and adaptation. We are running a bit late. If Dr. Raman is still with us, I realize you have to step out for a meeting, but if you can quickly come in with your expansive experience on opportunities for synergy between climate adaptation efforts and public health priorities. Dr. Raman, you're muted.
Yeah, I hope you can hear me now. Thanks for this particular discussion and looking at various aspects of climate and disasters and trying to link and integrate them with health. And what I've been asked about is to mainly discuss about how to integrate policies of this climate related issues in public health. That is where I'm going to focus on, and essentially based on some of my previous experiences and the current work that I do. So one is I used to be the founder and later director of the State Health Resource Center in Chhattisgarh, Punita, represented there, and I've been part of the some of the climate-related disasters when it happened in India. I've been part of the teams that supported health measures, particularly the Orissa super cyclone and later tsunamis and all. So I've been part of supporting the governments in health measures. And the Kerala floods, of course, that is another discussion that already has happened. So many of my points have already come. So what I'm concerned about when it comes to climate and disasters and public health is that the health always see themselves as at the mitigation side, at the response side. They don't see because that is how the public health and healthcare is positioned. So they are supposed to be, once something is happening, they are there and they are supposed to reach out to people and to provide necessary relief mechanism, whether it is medical aid, whether it is care, whether it is water, whether it is cleaning water, so on and so forth. So we need to see this, the policies, when we are talking about the public health policies for climate change and disasters. It's very, very important that it is focusing on adaptation, it is focusing on resilience part of it. It is also looking at risk reduction and the preparedness part of it. So all, the policies that climate related public health policies and also public health related climate policies. We need to look at this from two directions, and both these directions needs to be, the outlook should be, giving out or, taking up the response part as given or the mitigation part as given. It need to focus on the what you call adaptation side of it, which is one of the critical issue that I would like to highlight first. The second part is that earlier from Kerala, there was one interesting presentation about the vulnerability assessment and all. So the important part about policy integration here is that how each of the states identifies various climate-induced disaster possibilities across that particular state. This is being a state subject. The state interface is very important. So the states has to be particularly. I see that NIDM had this presentation about what needs to be done, the broader guidelines, the action areas, everything is clear. But at the state level, if someone is a health secretary at the state level or a director of public health at the state level, what are they supposed to do? That kind of a policy framework is very important. So that is where this vulnerability framework, assessment framework, identifying specific potential areas, the potential vulnerabilities needs to be understood and predicted, and all possible planning needs to be done. So, for example, when I was part of a assessment, 2019, when in Wayanad, after the floods in Kerala, when this Wayanad assessment was done, one of the important things that we realized was that the district hospital to the medical college that was being established in that place, and various health facilities, the preparedness part, the resilience part was relatively weak. So the policies here needs to be looking at this. Similarly, Dr. Praveen was talking about the heat wave and the temperature rise over the winter, two extremes he was talking about. And in this two extremes, it's very important that my work in Odisha, I mean, this is way back in 1999, almost 25 years now. So at that point in time, the idea was how to map the heat stroke, how to expect various problems and casualties and preventing them by way of provisioning preventive measures. So this part at times don't fall under the public health department's regular mandate, but policies need to look at this and integrate these specific measures, including giving support and relief to workers and so on and so forth into that public health mandate. So that needs to be done. So in Odisha, when we did this, I recall my work with Dr. Madan Mohan Pradhan, Rubin, and various other people at that point in time. When we had this preparedness and all these things were done, we could substantially reduce the incidences of heat strokes in the state compared to the previous, recorded kind of number. And not only the reduction of the overall incidences, also the death rates, which used to be very high, that was also significantly less. Although research papers and related knowledge products did not come from these kind of initiatives, unfortunately. So that is one thing to be focused on. So similarly, now Dr. Praveen has already told about Kerala and Tamil Nadu and similar states. The March is going through a significant higher temperature, which we have not seen in history. So how would we integrate? Not only when we say public health, we need to see this, the water sanitation and hygiene needs to be seen in this, while in the departmental distribution, of course, the NADM presentation has seen it as a allied or themed department, the water sanitation and hygiene, but like it happens globally, we need to see water sanitation and hygiene as an integrated and essential component of public health measures. So public health So despite being, departments may be different, we need to look at water, sanitation and hygiene, food systems, and also, integrated to this. And then, try to link and build convergence with essential supplies that is required. So all these need to be lined up. Then comes, the air pollution related, what all are the kind of preparedness that is required, what all are the mitigation measures that is required. So those policies needs to be integrated into health. While, we have a scientific and academic branch of environmental health, I am also, I used to be part of the advisory board to the Center for Environment Health that was run at the Public Health Foundation of India. But the environmental health is not clearly seen, within the public health departmental structure. So that is something to be addressed here as well. When it comes to the climate and public health linkages, we need to build up the importance of environmental health over there. So air pollution needs to come, extreme weather needs to come, temperature, rise or deep, drop, that needs to come. And there are a boom of post-disaster diseases, whether it is vector-borne diseases, whether it is waterborne diseases. So we need to consider those kinds of things. And if it is a fire, if it is a temperature drop, if it is a temperature rise, all these will have some specific kind of health problems associated with it. I'm not going into the detail for the reason that the timing is already up. So these are something to be looked at and policies to be framed. And for all this, drought-related water supply policies, another, and starvation-related issues during the droughts is another kind of issue that may come. So public health, we need not to see this from the conventional Indian picture of a department-based public health, but it should be a broad-based public health which covers almost all aspects of health. And then we need to go for a data-driven resilience approach. That should be an integral part of the policy when it comes to climate-related public health policy or public health-related climate policies. So research needs to be, centered and regular, kind of ideas of what happened and what are the experiences, what are the key learnings, what can be the next year's preparedness from the current year's learnings. So these kinds of rigorous planning process integrated into the policies. And finally, I'm coming into one is this health infrastructure resilience, how to build it up. Some discussion has already happened. Building the local bodies into the public health center is something very, very important. That point is something that we have not discussed across various themes. So the importance of urban or rural local bodies is very important. Capacity building has been told, but that also requires the policy, kind of integration and dealing with the lives and death scenario, the mental health scenario, how to integrate mental health policies into the public health responses, another one. And for all these, from the kind of center that I am working on currently, the Center for Budget and Governance Accountability, the budget and financing, adequately provisioning all this for all these kinds of policy integration is important. When it cannot be just a written paper-based wish list. It needs to be something actionable kind of a policy with a very clear implementation framework and planning, wherein wherever necessary from local level to district level to provincial level to national level, and wherever international linkages are needed, all these needs to be sufficiently financed also, so that the actions are not limited because of the resource constraint. I'll stop here. Thank you.
Thank you, Dr. Raman, for summing up the discussion that has happened so far and also highlighting the policy approaches that we can take, including data-driven resilience, and also devolving national guidelines into implementable local strategies, and looking at public health and climate change from a preparedness perspective and not just a mitigation aspect post an event. Thank you so much. We have run a few minutes over time, but if you have any questions that participants would like to ask to the speakers still on call, if that's all right with the speakers also, we can stay a few minutes to take any questions. Though I see that on the chat, many of the speakers have been actively interacting. Yes, if you have any questions, please drop them on the chat, or you can unmute yourself and share your thoughts.
Hello, am I audible?
Yes, please go on, sir.
This is Raj from AIG Jharkhand. Is there a national repertoire for the case studies, things to do? Because one can see a lot of good work done across the nation. But is there a place where the information can be accessed?
Nita, you're not audible.
Yeah, I hope I'm audible right now. Hi, sir. I would like to add upon that question. Recently, National Program for Climate Change and Human Health, they have invited case studies across the nation from NGOs and from the state government, and has been presented in the NPCCH conference. So this has been published by the NPCCH as a separate document. I think you can find it in their website, which has similar around work on different aspects of public health and climate-based works, studies, and reports. They have aggregated it together and published. I think that will be more helpful at this point.
Any additional questions, if anyone has? Also, we would like to highlight that through this is an initial discussion, and through the Health Sector Committee of Sphere India, we will be taking up many such discussions and initiatives, since the topic is of crucial importance. And we plan to have many thematic dedicated sessions, and we will get in touch with all the participants, and please watch our space for more such discussions. And we'll also share all the resources used by our speakers after the session. If you have any further questions, we can also direct them to the resource persons if you drop us an email. And please get in touch with us for any topics that you would like to explore on the intersections of climate change and health. So if there are no further questions, I would like to hand it over back to Hannah. And thank you once again to all our speakers who have stayed on till the end, even though we have overshot the time. And thank you for all your valuable contributions and for highlighting all these crucial and very varied impacts that climate change can have on human health and public health resilience.
Thank you so much, Michelle. And it was indeed a wonderful session. We could hear a lot of different perspectives on climate change and health. So thank you to all the speakers. Since we have gone overboard on time, I would just like to extend our warmest thank you and gratitude to all the speakers for coming and sharing your expertise. I know it is a busy schedule for everyone, especially since it's April. Thank you so much for all of your time. And also I would like to extend our thank you to all the participants for staying with us till the end of the session, and also to our moderator, Michelle. Thank you so much, everyone. We will be sharing the recording of the session and also the presentations used by the speakers once we get it from them, and also the report of this meeting later with the feedback form. So kindly take a time to provide us with your feedbacks. And that's it. Thank you all once again, and hope to see you all for the upcoming sessions. Just to give you a brief, please feel free to leave. I will just letting you know that our next session will be in collaboration with IIT Rajasthan. So if any of you listening to us are from this state, please feel free to scan and register. Thank you, everyone.
Thank you so much.